Yeah, a little
It's
bit
okay.
Yes. So good morning and good evenings for all the participants of the ICC today with us. We are so happy to have Professor Sanford Ratner. And today we have the beginner, the introducer, our chief, Professor Clement here. Later, he will give a short introduction about Professor Sanford Ratner. And then Professor Sanford Ratner will follow for his presentation. And after his presentation, we have around 20 minutes Q&A session. So we can start, Professor Clement. Thank you.
Thank you, Professor Zhou. And good evening, everyone. And welcome to the ICC. Today we are very happy to invite Professor Sanford Ratner. He was graduate from UCLA with the major of chemistry, went for dental school in Northwestern University, Chicago, Illinois, and then completed his oromaxillofacial surgery residency in Long Beach Veteran Admission Hospital and UCI Medical Center. Dr. Sandy is an expert in all aspects of oral and maxillofacial surgery, including dental alveolar oronaxis surgery, temporomandibular joint pathology, prosthetic and reconstructive surgery. He was clinical professor, Department of Surgery, UCI Medical Center from 1998 to 2004. Currently, the chairman, Department of Oral Surgery and Dentistry, Children's Hospital of Orange County. The team member and affiliated surgeon, Craniofacial team of Orange County. Clinical faculty, Department of OMS Surgery, and then UCLA Medical Center and faculty of AOCMF North America. He runs private practice in Santa Ana and Orange, California, also affiliated with Ronald Reagan UCLA Medical Center, St. Joseph Hospital, and the Children's Hospital, Orange County. Dr. Sandy lectured around the world, covering topics from facial trauma, cleft lip palate reconstruction, oronaxis surgery, PM joint surgery, and OSA surgery. Sharing the same value of surgery first and patient first, Sandy became close friend with Chang Craniofacial Center. He also gave lectures in Chang Forum from 2015 18 to 2019 before the COVID pandemic. Above all, he is the co-founder and chairman Open Heart Foundation, which is the charitable foundation formed to finance surgical correction of craniofacial deformities in non-funded children in Asia. And he also went for 39 medical missions in 9 countries and got humanitarian award many times. So now let's welcome Professor Ratner to give us the lecture. Professor.
Okay. Thank you very much.
Thank you.
So I was given the topic for this discussion, what has made me into the surgeon that I am? And rather than talk about the transformation of me from a general dentist to an oral maxillofacial surgeon, I'd like to discuss the experiences that I've had over the last, I hate to say this, 38 years as a surgeon. I think that what really has made me into the surgeon that I am is due to meeting and working with surgeons all over the world. My post-education development as a surgeon did not expand until I started traveling and meeting some extraordinary people, as you have in Taiwan. Open Heart is the name of my philanthropic foundation. I did not come up with this idea. One of my residents who came to Chang in 2010. Rocky was her name. She came up with this whole idea. She came up with the logo, the name of the program that we have, and she designed the entire aspect. So I have her to thank. She has now finished her plastic surgery residency and practices plastic and reconstructive surgery as well as oral maxillofacial surgery in North Carolina. So let me go next. So the question is, how did I turn out to be me? And you can see what I put down here, all the ideas that I had about me. And I think this is pretty much about everybody. We have educational opportunities that we take advantage of. We have a desire in the specialty that we work in. We want to help people, which is probably foremost. I was in the right time and right place to start this, which was pure luck. I have had mentor encouragement all through my life, and I still have these mentors with me. And then I have faith in my abilities and faith in what I have the ability to do and help people. I try not to do things that are not necessary and do the right type of surgery that I feel is necessary. I practiced general dentistry for 3 years and was unsatisfied with what I was doing. I felt that for the 4 years that I was in dental school and 2 years that I was practicing general dentistry, I was unhappy. I didn't enjoy doing dentistry and I didn't enjoy the limitations that I had being a dentist. So I applied for oral maxillofacial surgery to multiple schools and was accepted into the school at UCI Medical Center and the VA in Long Beach. It was at the time that I was applying, it was very difficult to get into an oral maxillofacial surgery program. The amount of applications they had was in the thousands, and the places open for residency were less than 100. Sorry about that. During the period of time that I was practicing dentistry, my younger brother passed away from a water skiing accident. And I realized at that time that we really only have a certain amount of time that we're on the earth. And I didn't want to spend it performing amalgam fillings and cleaning teeth. I felt that I had a higher calling, and I had an introduction to oral surgery as an intern in a regional hospital in Oakland. And I spent that internship being amazed, being so excited about what was going on around me that sometimes I couldn't sleep at night. I wanted to be in the hospital 24 hours a day. And I realized that this was a much better situation than I had doing general dentistry. The best decision I ever made. She is the same woman that I married 44 years ago, and we still seem to love each other. But following my residency, I took over a practice of a surgeon who was the first surgeon in Orange County to perform a maxillary osteotomy, and it was pretty impressive. He was an older man. He was younger than I am now, and he was a great role model. As far as being a single degree dentist working in a regional hospital, he was one of the first people in Orange County to do this. And my transition into a hospital dominated practice seemed to be seamlessly. It helped that the surgical residents and staff from my residency all transferred from UCI Medical Center to St. Joseph's Hospital and Children's Hospital in Orange County. So I had a group of people that I could trust that could help me do the things that I had done as a resident. And it seemed to be a smooth transition. So I think everybody needs a mentor, and I was lucky enough to have two mentors in my life. And the person on the left is Craig Bloom. And Craig was the chairman of the oral maxillofacial surgery residency program. And I think he tried to throw me out of the residency 2 or 3 times because I was doing things that he felt was not appropriate. And that was basically working with the ENT doctors and the plastic surgeons during the residency. He wanted me to be an oral maxillofacial surgery resident. I wanted to be a resident in all aspects of the head and neck surgery. So, but he did give me leeway to do what I wanted to do, to take rotations that I wanted to take. And every night I would go to his office and we would sit down and talk about what I was doing. And it was a wonderful situation. The way that he accepted me into the program was a little unusual. I went for an interview, and after the interview, I sat down in his office with him one-on-one, and he said to me, "What would you say if I were to offer you a position in our residency?" And I told him, after thinking about it for a second, that he did not get that answer until he actually accepted me into the program. Once he accepted me in the program, I would then tell him what I felt. He laughed, and off I went. But under his guidance, I began the process of being who I am today. He gave me the ability to achieve the experiences that I need to be an adequate surgeon. And to this day, he's still one of my closest friends. He's been there for me for everything that I've ever needed. He was actually a guru as far as I was concerned. He was demanding of the effort that we put in. He required full attention to our training program, and he allowed me the freedom to create rotations outside of our specialty. Oh, I'm just sorry about this. I made close friends with the residents in head and neck surgery, ENT surgery, as well as plastic surgery. And we often operated together in the same patients and became close, intimate friends throughout the 4 years of my residency. And I felt that having friends in different specialties rounded out my education, and many of these the surgeons that I did my residency with, I still see today, I still operate with today, and I feel that these friendships will never disappear during the period of time that I'm alive. I know that by working together, we educated each other, and we influenced our treatment planning and surgical approaches. This process is paramount to my continuing education and clinical advancement. So as time continues to be a major role in my development as a person and surgeon, this brings me to the major point of my development. What really has made me the person I am is the experience that I've had in the operating room and with these surgical friends that I've made. And the more I experience differing diagnoses and treatment alternatives, the more I become well-educated and a better surgeon. My development as a person and surgeon is directly related to the diversity of my experiences as a health provider. And in 1984, the last year of my surgical residency, Professor Ari Steyer, who you see on the right-hand side, he was a chairman of oral and maxillofacial surgery and dean of the dental school at Hadassah Medical Center in Jerusalem. He came out to spend a year with us. It was the best year that I ever had as a resident. For some reason, he and I clicked. We made a bond together, and I spent my entire year just asking him questions and asking him to help me with surgeries that I wanted to perform, but didn't have the capability. And to credit for him, everything I said, everything I did, he was there for me. And again, to this day, he is one of my closest friends. I talk with him on a routine basis. He is now retired. He's in his 80s now, but he retired about a year ago. And I went to visit him about 2 or 3 years ago at Hadassah, which I'd done many times in the past. He's just a wonderful man. Pretty much like you, Ray, is to you guys, that's how R.E.H. Steyer was to me. So what he did though was he never gave me an answer to the questions I had. He used the Socratic method of teaching to help me find the solution to my questions. I think that so let's go on to this. So how did the real question is how did I get interested in doing international mission work? Not just international mission work, but international education. And it all happened in 1999 when I received a phone call from a head and neck surgeon in the Philippines. I was sitting in my office doing what I normally did on a daily basis, seeing patients, doing consults, and the phone rang, and the person on the other line asked me if I was free to come to the Philippines. They had a patient that was a 4-year-old child in Nepal. He had fallen down and broken his jaw. This had happened approximately 2 years before they came to the Philippines, and they said that he couldn't open his mouth. So I said, well, he's probably got an ankylosis. He probably has some bleeding into the joint. He fractured the joint, and he probably has an ankylosis. All we need to do is go in and clean that out. And this is the time before we had total joint prosthesis, and I was using rib grafts to correct these problems. So I said, yeah, you just need to have somebody go over there and open the area up and clean it out and put a rib in there. That's all you have to do. And then it was quiet on the phone. And then he said, well, could you come and do this? And I had never traveled internationally before. And I said, well, I probably could. So when do you want me to come? And they said, well, can you come tomorrow? The Philippines is kind of far away from Southern California. We had a little discussion about it. And I said, I can probably come next week. And that was acceptable to them. So this is the group of people that I met once I got to the Philippines. This, if I can use my pointer, this obviously is me, and this is Dr. McGann, and he's one of the people that helps set this whole thing up. All of these people over here are all surgeons, and they just wanted to get into the picture and wanted to help. This is Malcolm Deal. He's an oral surgeon in Australia, and this is our patient Deepak and his father. And this is just a volunteer that happened to be there on the day that I came to the Philippines. So when I first got there, they opened their arms and said, "We're so happy to have you. Can you give a 2-day seminar?" And I thought I was just here to operate. They said, no, you have to give us education. Can you give us a 2-day seminar? And I didn't bring anything with me, so I had the night before the seminars, I had to write my entire lecture and give it and present it to them. And I thought there was only going to be this number of people that were there. And when I got to the hospital in the morning and got to the lecture hall, this is what I saw. Me. So I was in front of an auditorium that held over 100 people. And now I had to give this talk that I was ill prepared to give, and to all the surgeons in the Philippines. After I ended up giving one discussion on temporomandibular joint replacement, they also asked for another lecture, which I gave on the surgery that we were going to do, the temporomandibular joint, and how it related to orthognathic surgery. So this was a learning point for me. It taught me how to think on my feet, which I had never been able to do before without preparation. So this is the actual ankylosis that I was reducing. So I got to the operating room and I prepped the patient, and the anesthesiologist was amazing. He intubated this patient perfectly. We didn't have to do a tracheostomy. And so I asked for the drill for me to reduce some of the bone. And they told me that they didn't have a drill. I asked them how I was supposed to do this without a drill. So they sent one of their residents to the hardware store. And if you notice, what they brought back was a Dremel drill. And I don't know if you've ever operated with a Dremel drill before, but it's pretty unyielding. But I was able to create the opening. And what I didn't realize at the time was that there were 20 people in the operating room with me, but there was another 100 people in an auditorium that was linked on the video to the operating room. So they wanted me to discuss what I was doing the whole time I was operating, and I can't think of two things at the same time. I can't operate and discuss it at the same time, but I managed to learn how to do that. So this was the operating room, and you can see that there was a lot of people in there, and another 100 people on the outside. At the time of reducing the ankylosis, I forewarned the crowd that was in the operating room and the people watching on video, on remote video, that when I was about to release the ankylosis with a chisel, I said either one of two things are going to happen. One is that the mouth's going to open and everything's going to be wonderful, and the other is there's going to be more blood than you've ever seen in your entire life, because the internal maxillary artery runs just medial to the head of the condyle, and I was quite nervous about hitting that artery. So after I was able to release the ankylosis, I heard this group of people clapping, not from in the operating room, but from that video monitor, which was pretty amazing. So during that period of time, I spent about a week and a half in the Philippines, operating every day, doing everything imaginable, and teaching their residents as much as I could. And it turned out that the majority of people that I was teaching were the staff in the hospital, not the residents. It was a great experience for me. I actually loved it, and I felt, well, I've got to do this again, because this was just it was just the most exhilarating experience I'd had as a surgeon. So the next year, I got invited back, but this time not to USC, because I had operated at the University of Santo Tomas before. I came to a small town called Lucena, and this is the hospital. So I know you can't see this, but this is my friend who invited me, and this is me, and this is the front of the hospital. So when we got to the hospital, I realized that there was a recurring theme when you travel. And the first thing is that you've got to meet with the chairman or director of the hospital, and he's got to give you privileges to be able to do what you're going to do. So it's something that every place I've ever been that I've operated, I've had to do this. And I try to be nice about it, and I try not to be I guess embarrassed by this whole process. But this was the person here that that was the director of the hospital, and we had sent everything to him, all of my licenses and CV, and he asked us, me and my friend, why we were there. And I said, well, we sent everything to you 3 months ago. I thought this was all settled. And he said, well, I just want to know why you're here, because we can do these surgeries. We don't need you to do the surgery for us. So I said, well, have you looked outside? And he said, what do you mean? I said, well, if you look outside, you can see all these people that are waiting to have surgery that you're not operating on. And then my friend, Francisco in Verga, said to the director, he said, Mr. Director, you're embarrassing me, you're embarrassing my friend, Dr. Ratner, and you're embarrassing my uncle. And so he was very snotty about this. And he said, well, I see you two, but who the hell is your uncle? And he said, my uncle is governor in Verga of Quezon County. He's the person that appointed you to your position. All of a sudden, he gets up, stands up, comes over, puts his arms around me and says, welcome to Lucena. My hospital is your hospital. And I thought that was quite interesting. It's like that in a lot of different little countries. They don't want to give up any of their autonomy. So I spent about a week there with him and with my friend Francisco, and we operated. Francisco was a general dentist, but we operated quite a bit and enjoyed. And I saw a lot of patients there, and some of them came to California for me to do follow up on, which was fantastic. So while I was in Lucena, the surgeon that I had met when I operated on Deepak came from Nepal and operated with me, and he invited me to come to Nepal. So I could see that there's a transition here, that the more people that you meet, the more people are going to want to be involved with you. So he asked me, when could I come? And I said, well, I can't come now, but maybe next year. And so he said, okay, I'm going to count on that. I'm going to give you a date, and then you're going to come. So the next year, I ended up at the Roof of the World in Nepal, which I'd always wanted to go to, because I thought this is the place where things happen very slowly. And I ended up going to Kathmandu about, I don't know, 4 times, maybe 5 times so far. And if you look at this is my surgical team, this whole thing. This is me here. This is the oral and maxillofacial surgeon in Nepal. Then these are his family. This is my wife. And what I did have the opportunity, I was able to bring my son on this trip as well. And he was a senior in high school, and I thought this would be a great experience for him. And this is Malcolm Deal, the surgeon from Australia. So we did the triage the way that I normally do it, where we see all the patients, and then we order them for the way that we want, the way we want to do surgery, in the order that we want to do the surgery. We start with the most difficult patients first and do the easiest patients to the last. And then when we finish doing the surgery on all the patients, I stay there for another 2 to 3 days to make sure that there's no complications or problems before I leave. So this was a real eye-opening experience for my son. He had never actually been in the operating room with me. And a few times he didn't want to be in the operating room because he said that he was getting a little bit nauseous from watching what we were doing. But as in the Philippines, before I could operate, I had to give a lecture. So this is now getting to be something that I felt very comfortable doing in front of people. It's a little bit harder doing it online because I can't really get a feel of what everybody's thinking. So pardon me if I seem to be a little bit off, because I just have a little bit hard time lecturing online. But so this is the group of people. It was a gigantic room, and there was about 30 surgeons in there, which is the sum total of all maxillofacial and plastic surgeons and ENT surgeons in Nepal. And Prashant was so welcoming. He was such a wonderful guy to work with. So my first patient that we had had polyostotic fibrous dysplasia, and I had never actually seen anything like this before. So the question was, what are we going to do? And I really didn't know what to do except for start to reducing some of the bone. And as you know, polyostotic or any kind of fibrous dysplasia has a very high content of blood in the bone. And so I had asked for at least 2 to 3 units of blood for transfusion because I knew it was going to be a bloody procedure. Well, they didn't have any blood at the time of the surgery. So I made my first incision here, and it started to bleed, and it was kind of a little bit messy. My son almost fainted in the operating room. They had to take him out of the room. And so at one point, I heard the EKG was not making any noises, and the anesthesiologist started hitting the EKG machine. So I put my finger on her carotid artery, and there was no pulse. And I said, we need some epinephrine right now. And the anesthesiologist said, well, I only have this one vial of epinephrine and it's not for her. And so I asked my friend, the surgeon, I said, can you get that vial away from the anesthesiologist? And he went over and he tackled him right in the middle of the operating room and took the vial out of his hand. And we gave the patient the epinephrine and brought her back, started doing CPR, and the patient did live. But I stopped the surgery at that point. And it was a harrowing experience, but at least we knew what to do and we were able to save her life. So one of the surgeries I had to do was another ankylosis. And that one turned out to be pretty much the same as the last one. We took a rib graft. They brought the patient in at 5 o'clock at night and said, oh, can we add this patient to the schedule? I said, well, this is a pretty big surgery. Can we do it in the morning? Then no. The patient has to go home, and he lives 200 miles away, and we have to do the surgery today. So we started the surgery at like 7 o'clock at night and finished it around 10, and the surgery did go well. So what we would do in the periods of time that we were not operating is we would talk with Prashant. And this person here is one of my residents from UCLA. He was a chief resident at the time. When Prashant called me to come to to Nepal, I was at UCLA doing lecturing to the residents, and one of the residents said to me, "Oh, I'm going to Nepal." I said, "Oh yeah, when are you going?" And he said, "When you're going." I said, "So you mean you're going with me?" And he said, "Yes." So he became one of our consistent surgeons that we go on missions with, and it's been a pleasure having him. But you can see, while we were operating, my goal was not to operate. My goal was to assist in the operating. But the residents, and this is Prashant here, they wanted to watch, and I don't think that watching is as good as operating. And so when I travel, I don't want to really operate. I want to sit there with them and help them do the case, because once they've done something, they can do it again. If they just watch, it's hard to learn. So while I was in Nepal in 2010, I ran into Deepak, who now was 14 years old and eating and doing well and thriving. And it was such a pleasure to see him. Then I got a phone call from a group called Project Vietnam. And they asked me if I would come to Vietnam with them because they didn't have anybody that knew how to do an alveolar bone graft. They had all the plastic surgeons in the world, and these are them. This is Alex Kim. This is Dr. Norris, and then this is one of Dr. Kim's co-residents at the time, and of course me. So we went to this small little town in Vietnam. It's called Lang Son, which is right on the border of China. And from what I understand, that when China decides that they want to take over Vietnam, they march through Lang Son. So I hope that they weren't going to come and march through Lang Son while I was there. But it turned out nice. So we did triage, and this is Dr. James Norris, who trained with Dr. Millard in Florida. And this was his last surgical mission. And I was just lucky enough to be able to spend some time with him. So here you can see that here we're just discussing the patient's care at this time. But what I didn't like at all about going to Vietnam with Project Vietnam is that when they go to a hospital, they take over the hospital. They don't invite the local surgeons to operate with them. They don't discuss the care of the patients post-operatively. They just go in, take over the hospital, operate for 14 days, and then leave. And there's no follow-up. So I thought that this was a problem. And when I got asked to go with Project Vietnam again, I said, only if we can work with their surgeons. And they said, yes, we certainly can do that. And so we went to Vietnam the second time. And again, the same kind of thing. They took over the hospital. There was no communication between the native oral surgeons and us. And so that was the last time I went to Vietnam with them. But I've been to Vietnam numerous times since then, and have enjoyed it. And the way that I've done that, I'll show you. So this is Dr. Norris operating, and this is me trying to assist him. So a friend of mine, Chris Nguyen, this is Christopher right here. He's from Vietnam. He left Vietnam in 1965. He was on one of the last transports outside of Vietnam during the war. This is his uncle, Dr. Han, who has been a supporter of us. This is Ben again. And Chris decided that we should all go to Vietnam and with our own program, treat patients. So we discussed our mutual desire to form a team with the paradigm of education and collaboration. And that was one of my biggest goals. I didn't want to do what we had done before in Project Vietnam. So that's a great dichotomy between experiences with Project Vietnam versus those with USC and the National Dental Hospital in Kathmandu. By seeing 3 different situations, I was able to develop a mission statement, which I had been working on and sweating over for a long time. And what I wanted to accomplish was educate the surgeons in the area that we were going to, and help advise any way that we can. And usually what I do when I travel is we meet the surgeons in the area, and then we invite them to come to California and spend some time with us, which is learning for me and learning for them. But you can see the difference here. This is Kathmandu. Not a lot of electronic things, not cars or scooters or much. And here's Vietnam, which I found out while I was there that there are 20 million people that live in Saigon, and there's 21 million scooters. So there's more scooters than people. And what you see is they'll put 5 or 6 people on one scooter and drive around, and they don't wear helmets. It was scary to me. And if you step off a curb, you better be ready to jump back onto that curb because somebody's going to run you over. I never got hit by a car, but I always was worried that was going to happen. So this was my mission statement that I developed. That we wanted to define ourselves as a nonprofit organization, but we don't take donations. We pay our own way. We pay for the care of the surgical patients we work on, and that way I don't have to answer to anybody. I don't feel uncomfortable with paying it. Paying the way for us, our travel expenses, and paying for the surgery in the hospitals that we operate in. I feel comfortable about that, knowing that I don't have to answer to the hospital and I don't have to answer to any donors. So one thing that I realize is that the surgeons in the areas that we go to are extremely talented. They're very talented. But what they don't have is they don't have the equipment. They don't have the knowledge either. They don't have the journals that we all have. They train in the hospital with people that train them, and they operate, and they do the best job they can, and usually it's pretty good, but they don't have all the instrumentation that we have. So now when I travel, I bring all my instrumentation with me, and then I leave it there for them to use it after I leave. And I also demand that they operate with me at the same time, and that they have close follow-up, sending me pictures on the patients that we've operated on over a period of 6 months, which has been a major difference between what I'd done in the past. So this is Ben again and me, and this is on the last day of operating at the Odontomaxillofacial Hospital in Saigon. And it was pretty tiring because we would start at 6:30, 7 o'clock in the morning, and we'd operate till 10 o'clock at night, and then go on rounds first thing in the morning before we started the next day's surgery. And I learned to bring textbooks and other equipment with me. It was just something that was, this whole thing was an experience on what we have to do to develop our program. So the other thing I realized is that we had to meet with the local dignitaries every time we go to a new hospital. We have to meet with people, and at first I had a hard time doing this, but now I kind of figured out what they want to hear, and what I want to say, and the this whole process now is not, it's not foreign to me, and so I understand clearly what they're looking for. What most hospitals are looking for is that we're safe, that we do a good job, and that we pay them for the surgeries that we do. And I think that last thing, the pay, is the most important to them. So this is Dr. Viet. She's the oral maxillofacial surgeon who's in charge of cleft lip and palate in the hospital. And this is the chairman of the hospital himself. And I don't know where I am. I don't see me there, but I must have been there someplace. So this is kind of what Vietnam is compared to any other place I've been. So this is the post-operative rooms on the third floor of the hospital, and you can see how many people are there, and they're all got their kids. So there's the mothers, the brothers, the fathers, the grandparents. Everybody is there for their kids, and it's very difficult to go on rounds after surgery when you've got this many people and they're all chasing after you. Look at my baby, look at my baby, and I try to be as nice as I can. So finally, we made a rule that the babies have to be in their beds when we go on rounds, and there's can only be one family member in the room at the time. So there are usually 6 to 7 beds per room, and so if you count 30 people are there to see only one patient, it looks something like this. It's madness. And so what I wanted to do was add education into our missions. And so I talked to Dr. Viet, who said we have many teams that come here from all over the world, and nobody talks to us about education. And she was very interested in us doing this. So we all sat around the table. This is Chris and Ben and me, and this is Dr. Viet, and discuss what they wanted and what we were able to provide. My goal was that we would work as a team with their residents and their staff, knowing that they would be there while we're doing the surgery and helping with the surgery. So we would triage every patient, and this is Ben looking at the x-rays and me looking at the patient, Dr. Viet being also in concert with us, and then their residents are here. So we did this for every patient, and we definitely were able to establish a triage program that worked for us and for them. We would also give formal education on every time that we went. We would ask the chairman of the programs what they wanted to hear, and then we would give these lectures. And the lectures were a 2 to 3 day event, besides the 5 to 10 days that we were there operating. Oh, let's see. And so this is what the operating room looked like, with them operating and us helping. And this was pretty much what I wanted to establish. I wanted to make sure that they would be intimately involved in the surgery, and that we were just there to help them facilitate. Once in a while, we'd run up with an attending who would be on the phone the whole time we'd be operating. And this, you can see he's got his earphone in his ear, and and I'm trying to help him with surgery, and I just couldn't understand how he could pay attention to me and attention to his earphone at the same time. When I asked him to remove it from his ear, he was pretty much irate, and he would not do that. So we just operated that way now. Then after we were done from the surgery, we would go to the doctor's little lounge that they had, and we were pretty much exhausted because we were operating 12 to 14 hours a day, and we would do this every day in a row. And by the time we were ready to go home, we were just exhausted. But it was happy for us because we helped with the training of other surgeons, and we think that the surgeries that we did with them worked out well. But you can see Ben is pretty much out of it. This is Rocky, who Dr. Chen, I'm sure you might remember her. She came with us in 2010. She was the one who actually invited me to come with her, which was amazing. So then this is just one more case. And you can see everybody's in there operating, and I'm over here just talking. And this is one of their residents doing the surgery. We also brought a couple of residents with us. Every time I go, I bring some residents from UCLA. And again, this is the post-op phase, which is crazy. So every time we go to a city, we take pictures in front of the hospital, which I then transmit that into my office. And so I have all these pictures from all the hospitals I've ever been at in my office, which is pretty cool. And this was the team that we went down that year. And this was Rocky here. And this is one of our residents from UCLA. This is Chris, and this is another resident from UCLA. This is just what we did in the first 4 years that we operated with them. We didn't do a lot of surgery, but the surgeries that we did had meaning to the residents there, to their staff. So we did the first year that we did 59 triage, and it's pretty much stayed the same up to the 4th year when we did 75 patients. But we didn't operate on every patient that we saw. If they had any kind of cough or fever, those patients were canceled immediately. I didn't want to take any chances for any kind of complication in a country that I can't be in all the time. So I was very selective on the patients that we agreed to operate on. Then while I was in South Vietnam, I got a call from a surgeon in North Vietnam asking me if he could come and operate with us. And I said, absolutely. So he came down, spent a really great time with him. This guy really was a very, very good surgeon, and he was more teaching me than I was teaching him. And then he invited me to come to North Vietnam, and this is his group here. This is Dr. Ha. And I communicate with him all the time. And he came to California and spent about 2 weeks with me operating. And I learned every time I'm with him, I learned something special. He's a good surgeon. He was trained in Paris. And he's just a nice person. He treats his patients extremely well, and he treats his residents even better. He's the type of guy that everybody would like to be around. And so actually I'm going back to North Vietnam in the end of October. He has some hemifacial cases that he wants to do. And so I'm bringing some distractors with me, and we'll be doing those together. So triage in his group incorporates all of his residents. Everybody is there for every patient. And he speaks fluent English, and almost all of his residents speak English as well, but he always explains everything in Vietnamese to make sure that people are understanding what's going on. And it's a great system. I enjoy going there almost as much as going to any other place. So we see a lot of patients there. They have a lot of pathology, and we don't do anything that we feel is going to be a problem. We try and make sure that every patient gets the results. So I cut down the number of surgeries that we do, because I want to make sure that every surgery I do, every surgery that I help with, turns out positively. They have a lot of pathology there as well. You can see the salivary gland tumor, which I normally don't operate on, and I don't want to do anything that I don't do on a normal basis. So Dr. Ha did the surgery on this one, and I just observed and assisted him. And like I said, he's an extremely talented surgeon. And we would always have discussions about on every day before we did surgery. We look at X-rays. We talk about alternatives. And Dr. Ha is extremely education oriented. He works out of Vinh Duc Hospital in Hanoi. So what we would do is we would do our triage. We'd talk about what the surgeries that we're going to do that day. Then we'd operate. And then in the afternoons or evenings, we go back to my hotel room. And let's see if I have it here. I thought I did. Yeah, go back to my hotel room and put my computer onto the TV, and we would talk. And you can see that all of his residents would come. And this to me was just the ideal aspect. This is what I wanted to do. I wanted to obtain by creating a mission team. I would talk, then they would talk. They would teach me, and I would teach them. But you can see Dr. Ha over here. He's quite a funny guy. He's always making jokes, but when he gets in the operating room, he's dead serious. So after we finished the 14 days, he asked us if we wanted to go to Ha Long Bay, which I said, sure. I don't know what it is, but so this is Ha Long Bay. This is Dr. Ha. One of his friends has a boat system that allows him to take people to Ha Long Bay, and we spent that whole day drinking beer and discussing surgery and discussing life. So this is basically what puts everybody together. A little bit of alcohol seems always to put people together. And I know that I've tried to drink with Dr. Ure, and I cannot at all keep up with him. So every time I sit with him, he brings out some expensive alcohol and we start drinking, and I usually hit the floor before he even is drunk. But I love being there, and I love being with him. So basically, I just want to go over this a little bit. Obviously, this picture is well known to you. And the first time that I came there, what happened was Rocky had sent a letter to Dr. Nordoff and asked Dr. Nordoff if she can come and visit to the Chang Hospital. And Dr. Nordoff was so nice, he wrote a handwritten letter back saying that he no longer is associated with the hospital, but that Dr. Ure Chen was the chairman, and he would send a letter to Dr. Ure and try and establish Rocky's going to the hospital. So when she told me that she was going, I was very jealous. I said, Rocky, how'd you do that? She says, I just wrote a letter and asked, and they said I can come. Why don't you come with me? And I said, I can't just come with you. I didn't get invited to go there. You did. She says, oh no, it'll be okay. I said, no, Rocky, I'm a little bit uncomfortable with this. She says, well, I'll write to Dr. Ure and see what he says. And he was very cordial, and he said, of course you can come. So I said, great, I'm going. So we've landed on a Tuesday morning, and they had a transport for us, which is unusual. I've never had a transport taking me to a hospital that I was visiting. And they had transport, so they brought us to the hospital, and they were just in the meeting having their normal Tuesday morning meetings, but they waited until we got there, which I thought, wow, this is amazing. They're being so nice to us. And I met Dr. Ure and I met Dr. Lowe, and as we sat there in their meeting, every time they showed a patient, somebody would ask me, well, Dr. Ratner, what do you think? And I think, well, you guys know more about this than I do, but I'm happy to give you my opinion. So I found out that Dr. Ure is an expert in oral and maxillofacial surgery, especially in orthognathic surgery. And so I wanted to talk with him about it, and he was kind enough to sit down with me, and we discussed our philosophies on orthognathic surgery. And guess what? It turned out that we both had the same philosophy. We did it a little bit differently, but our philosophy was the same. And that was a one splint technique, which I soon found out that Dr. Ure had written a paper on. And I had been doing one split technique my whole life as a surgeon. I never understood why you couldn't just put the maxilla where it belonged and then bring the mandible into the maxilla using the splint. So we talked about it quite, and it was a very nice discussion. And he was teaching me and I was listening to him, and I was trying to, give my little opinion, but I, I, I was doing at the time 150 orthodontic cases a year, and he was doing 600 cases a year. There's a big difference between that. I felt that I was an active oral maxillofacial surgeon, but I'd never met anybody who was doing 600 cases a year. So we became good friends. And every time I go there, I love spending any time I can with him. It was just, this is what I had in mind when I wanted to travel. So I think establishing a relationship with a surgeon, no matter where you are in the world, it's just it's a God-given thing. And I've never been so happy as to doing what I'm doing. And so here's Dr. Ure doing surgery with his staff, and I'm watching, and I'm taking some paper out of my pocket so I can take notes. And here after the surgery, he's explained to me what he feels. And this was a teaching thing for me. I just listened to everything he had to say, and I didn't want to even interrupt because I was going to miss something if I was interrupting him talking. And here he is doing, this is my technique. My technique is you place the maxilla with one finger, you let the soft tissues drape over it, and then you look and see what you've got. You look at the yaw, you look at the cant and the lip to tooth relationship, and then you put the bone plates on. What Dr. Ure was doing was he would cut the maxilla and cut the mandible, put those two together, and then just bring them up into their proper position, which is every bit as good as what I was doing. I was just separating this a little bit. I was looking at the maxilla independently and then looking at the mandible after that. But I learned a lot, and I hope that what I can say is that Dr. Ure came and operated with me in California, and he stayed with us in our house, and it was a wonderful experience for me having him in the operating room with us. So this is what it's all about: establishing friendships. And this person here was one of the fellows. He is now living in California, and he was the one who was actually taking care of us while we were there the first time. And this is obviously Rocky. So I do go to Fiji, and in Fiji we don't do orthodontic surgery because what they're interested in is just keeping people alive. And this is Dr. Maloney, and he's a general surgeon. And he actually called me and asked me if I would be interested in coming to Fiji. And I have one of my residents at UCLA now in private practice is Fijian. And so I called Rocky up, and I called Hina up and asked her if she wanted to go. And we went. And so he had a few patients that he wanted to talk to me about, and this was one of them. He was a rugby player on the Fiji national black team. And he had this like gigantic tumor. But this is a fairly big tumor, and I was a little bit nervous about even thinking about operating on him in a situation that I don't normally sit in. But you can see the destruction that this tumor has done to his face. It was amazing what was left. So I said, sure, we'll do this. And so with Dr. Maloney, we did this case together. We opened him up from one side to preauricular region all the way around to the opposite side. We resected the area of the ameloblastoma, and I brought some bone plates and bone screws with me, and we reconstructed him. And here he is 2 days after surgery, which was pretty much of a success as far as I was concerned. I did see him the last time I was in Fiji was just last June, and he was still doing well, which was very helpful to me, because as you know, ameloblastomas are aggressive tumors that can just hide cells all over the place. And if you don't get all of them out, it's going to come back. And this is the surgical team in Fiji. They're extremely nice people, and they love it when we come. We bring all of our instruments and we leave them there, and they then use them until we come the next time. But every time we go there, they have a big party afterwards, feed us Fijian food. It's a wonderful condition for me. So this is something that I did at home, and I just want to talk a little bit about virtual surgical planning. This patient had a comminuted fracture of the mandible, went to an oral surgeon. The oral surgeon just put these, they're not arch bars, but they're like arch bars, just to wire them together, leaving this into a situation that was untenable. So an oral maxillofacial surgeon did this. He was not capable or wanting to open this area up. So he sent the patient to me, which I find more and more often in Orange County, that oral surgeons just want to take out wisdom teeth. They don't want to do major surgery. And then so if they have a case, they will usually send it off. So this is the virtual surgical planning. You can see where the fracture is here. And then we would then virtually, with an engineer, we would replace and put things back together where they needed to be. And then we had an idea of where we're going to go, and we made our bone plate that would then hold this in place. So we had a specific bone plate made for the patient, and went to the operating room. And this is what we saw in the operating room, just a bag of broken bones everywhere. So so I was able to put the patient-specific plate in place. Then we use a few other little plates in order to fixate the area. So I did talk about R.H. Dyer a little bit, the surgeon from Israel. I've been to Israel to work with him about a dozen times. This is the West Wall. This is called the Wailing Wall, which is a sacred place in Jerusalem. The rabbis go here and pray about for everybody. And if you have something to pray about, you hand them a little piece of paper. They read the piece of paper and they put it into the Wailing Wall. And it's quite an interesting situation. It's a very, to me, it's a very religious country, but they are not religious outside of where they are. If they're working, they're working. They're not religious about that. But I find them very, their attitude towards life is that you live by the moment because you never know when you're going to die, and we know that because of all the bombings that go on in Jerusalem all the time. So I have certain people in my life that have been very helpful and very rewarding to me. One of them is Dr. Brett Ferguson, he's at the time was the president of AMUS, the American Association of Oral Maxillofacial Surgeons, and he's become a very good friend of mine. I like to put myself in areas where I'm around people that I really aspire to be. This is a picture of the forum, Chang Forum, and it was from 2017. And there are there's a lot of people here, and it's hard to really see them, but there are some notary people. This is Tim Turvey, and this is Brian Bell. And you can see Dr. Lowe's over here and Dr. Uray's here. So before the actual forum, they usually have a dinner set up for the people who are coming to lecture. And I wasn't invited to lecture this time. I just came to be there. But Uray invited me to come to the dinner. And I sat next to Brian Bell and Dr. Turvey, who I'd never met before. And so it was funny that I had to meet them in Taiwan and not in the United States. But they both gave excellent talks. I was very happy to hear these talks. So this is my wife Hillary and I, and we are at the lowest point in the northern hemisphere. It's if you can read it, it's 282 feet below sea level, and it's really hot. I mean, they call it Death Valley for a reason. It's because you could die if you stay there for any period of time. But we went here about a couple of years ago, did some hiking, and it was very pretty. But like I said, it is the lowest point in North America. So I can't do what I do with traveling and being helpful in other countries without an understanding family. And my wife is extremely understanding, has been always behind me in every step of my progression as a surgeon and as a doctor. And I just can't say enough positive things about her. So, oops. So these are this is the North Vietnam team. This is the South Vietnam team. This is the team in Nepal. Unfortunately, Prashant passed away from a heart attack at 45 years of age. So that was a big shock to me. About 7 years ago, he died. He came to California and spent 2 weeks with us here, going to the operating room with me as well. And we miss him. So I think that I have few mentors in my life. Craig Bloom, who I showed you, Ari Steyer, who I also showed you. But Dr. Urey has been a joy for me. I've never been able to discuss things orthognathodically like I discussed with Dr. Urey. He's a brilliant man, and his understanding of orthognathic surgery is beyond anything that I could ever imagine that I would have. And I thank every day that I have been able to meet him and work with him. He came to California and visited us and stayed at our house. And it was a wonderful time that we had. We went to the operating room. We had many meals. And when he was leaving, I gave him my UCLA Bruin cap. And because I went to UCLA, I teach at UCLA, and he put that on and wore it. I don't know how long he wore it. I probably took it off right after we took this picture. But it was just a pleasure to see him with this hat on his head. And this is the team in South Vietnam again. And it's a great team. This is the anesthesiologist who's a fantastic anesthesiologist. Dr. Viet has retired from the hospital there. She's in private practice now in South Vietnam. We did have people that I need to thank. This is Chris's Uncle Han, who has sponsored a lot of our trips. He's fairly well-to-do, and every time we go there, he takes us to dinner and we spend time with him. He came to California. We went out to dinner with him here, and he's just he's somebody who's been extremely happy to help in any way that he can. And this is a picture I came to Taiwan with my son when we were traveling around the world in 2015, and Dr. Urey took us to his golf course at night, and you can see that we were all pretty drunk standing in that golf course. It was exciting, and Dr. Lowe was here as well. I gave a little bit of a lecture on, I don't remember what it was, but it was well received. I think people were happy. So I have an aphorism that many of you have heard, and that is that if you are to achieve expertise and notoriety in the specialty that you work in, the advances that you make can only be made because of the people who came before you. And it's been said very many ways in a lot of different idioms, but this is basically you're standing on the shoulders of people who were above you, so that way you can see further. I love that expression. This is what it's all about for me. This kid was from Vietnam. His mother has a sister in Orange County and brought him to California for me to take a look at him. He had an alveolar cleft that had been tried to be repaired about 2 or 3 times, and he still had a fistula. So I said, okay, we can do it here. And the mother said, no, I want to do it back in Vietnam. So, and she lived in North Vietnam. So on the next trip I took to South Vietnam, she brought him down and I operated on him, and he was just a joyous patient. He was wonderful, and we still communicate. This is my one true love, skiing. Anytime I can put a pair of skis on my feet, I'm going to do that. I love it, and I have friends all over the world, just like, you know, for surgery, that love to ski. And this is in Austria. So the question is, how did I become the oral surgeon that I am? And I could honestly tell you, it's from the experiences that I've had traveling. I use those experiences in my day-to-day life as in practice in California. I don't think that I could ever be what I've turned out to be without traveling to other countries and meeting other people and just assimilating what they've taught me. Not so much what I teach them, but what they taught me. So my support team is my family. And this is my wife. We went to Iceland and we were caving. My son is now 38 years old and married. I think you met Dr. Yurei met him when he came to Taiwan. Um, without them, I could never do what I do. So I want to thank you all for taking the time to listen to me. I hope I didn't bore you to death. But if you have any questions, I'm very happy to discuss with you.
Thank you so much, Professor Ratner, for the fascinating talk on your experience and how you built the Open Heart mission from the ground up. I think it's amazing for us to hear the story, and I think everyone had a great time. But before we go on any further, I'd like to invite our chief, Professor Lin, for some comment.
Thank you, Professor Ratner. And I would like to ask one question that for many of us young surgeons, when we go for abroad to another country or another center to do the mission surgery, sometimes we have fear or some worry or anxiety about going to another country or another facility that we are not familiar with. So what is your recommendation for young surgeons to be prepared mentally or in terms of the surgical skill preparation to go abroad for a mission trip?
I think that what I found to be the hardest part is the communication with the surgeons in the area that you go to. You have to be respectful of those surgeons, and you have to not think that you're going to come and teach them something that they don't know how to do, because everybody's got an ego, and you cannot destroy their egos. You have to build their egos up to the point that you feel as comfortable with them as they feel with themselves. And I think that is the hardest part. Once you've once you've met the people that you're going to work with, you don't. I never try to tell them, "Oh, we're going to do this and we're going to do that." Well, I always ask, "How do you want to do this? What is it that you want to accomplish with the surgery?" And then if they notice that you respect them, once you show that respect, they accept you into their fold. And I think that is the hardest thing for people to understand. If you just go and say, I'm going to come in here and I'm going to operate this because I'm the best surgeon you've ever seen, and I just want you to watch me do this, that's wrong. You want to go there with be humble with them, and find out what they know and find out what you know, and just say, how can we actually, I'm putting my hands together, how can we mesh ourselves to work together as a team? And I think that once you've done that, and if you have the capability to do the surgery that you are there to do, it should go smooth. If, however, you're not prepared for the surgery, that's going to be a problem, because the surgeons the surgeons in the country are going to say, they might not say anything to you because they want to be respectful of you, but behind your back they'll talk about what you did and how it was done wrong. And I never want to be in that situation. I want to be a situation that I understand. I want to know that what I'm doing with them, helping with them, is the right position. And if you go with that humbleness and basically the desire to learn from them as well as to teach them, I think you'll be fine.
Okay, thank you, Professor Lin. And now I'd like to invite Professor Lowe, who's been on numerous missions himself, for some comments.
Hi, Sandy. Thank you
Hi.
for your lecture. I actually enjoy very much. And I found that you and I have the same experience of going to the other country in the mission. And also the concept are very important. And I totally agree with you, is to teach and is to collaborate and help them in many ways that they need to help. But also in the process, we also learn from them. As you mentioned that you teach, you also learn from them. And in that regard, it's really a nice, presentation that, from your presentation that I remember many years in the past that we also did the same thing. And I also enjoy your open heart. Is that program or foundation? Really
Right
a
now it's,
fun logo, the open heart
yeah.
program. Yeah. But anyway,
Well,
thank you very
man.
much.
Thank you.
And for our next representative, I'd like to invite Dr. Bernard Tensipak who's from Philippines. Dr. Bernard, would you like to say a few words for us?
I knew you'd call me. Anyway, sorry, Dr. Ratner. I was actually I logged on to the Zoom meeting somewhere right at the start when you were talking about your experience in the Philippines, and I'm terribly sorry. I'd like to apologize for your experience that they made you do surgery, give a lecture at the same time without informing you. So that was back in 1999. I was a medical student at that time, and the Philippines is at this moment in transition when it comes to medical care. We're as right now, I'm president of the North Craniofacial Foundation, the Philippines. So what we're trying to advocate is to transition from a mission type of treatment to a center-based treatment, wherein the physicians get real training by going on fellowships and establishing uh, craniofacial centers to be able to treat the patient as a whole. So not just surgery. We have people training in anesthesia, people training in dentistry, people in training in pediatrics, so that we can up ourselves to enable giving these patients, no matter whether they're charity patients or private patients, the same level of treatment as they would get. No. So again, I'm truly sorry for your. I felt really bad when you were talking about your experience in the Philippines, with all the how to say it, political patronage that needs to be done, especially in the outskirts of Manila. But rest assured, I think we have transitioned to a better system at this time. So yes, if you do get messages from other doctors in the Philippines asking for help, you can always refer their patients to the NCF. And we've been treating patients with ankylosis, with orthognathic surgery issues, craniosynostosis, meningoceles, etc., for the past, I think, 15 years. So sorry for that. Again, thank you for giving me this opportunity to talk. But and thank you for your service in our country.
Well, thank you very much. That's, it's nice that you guys have the system set up. I applaud you. I think that's great.
And next, I would like to ask Dr. Fayyad for a few comments. Are you available, Dr. Fayyad?
I would like to congratulate Dr. Ratner for his services around the globe. And it's very inspiring. And literally, it's very difficult to go to a new place where you don't know many people, you are not familiar with the ground reality. I would like to share one of my incident that we went to Kabul, Afghanistan in 2014, and there was a patient who had a palatal fistula, not because she had a cleft palate. She ate very hot potato, and that led to necrosis of the palatal mucosa and the palatal bone. And while one of my we were trying to do the local infiltration, that young girl got cardiac arrest.
Oh,
And we were in a fixed we were in a new country, but luckily my anesthesiology team, they were able to work, and we had to give 3 electric shocks uh, by using our defibrillator, and it took us around half an hour to revive the girl. And luckily, my 2 anesthesiologists, they stayed at the girl for whole of the night, and we were lucky that she recovered fully. But we did not afraid that girl, and we just sent her home. So I appreciate Dr. Ratner's services to different countries to helping the people who needed his services the most. And I hope that sooner or later I will have a chance to meet Dr. Ratner.
I would certainly like to meet with you.
Oh,
That's a
yeah,
scary situation that you're in.
yeah.
I had that same situation in Nepal.
Oh my goodness.
And
It's,
now, sorry, please
that's right. I
continue.
was going to say that after you experience that and you are able to recover the patient, all you want to do is go to sleep. I mean, it takes so much energy. I'm sorry you had to go through that, but it's a learning experience for you, and you'll never forget it.
Yeah.
Now, last but the most important one of them all, Professor Yurei Chen. Professor Chen.
Hi, Sandy. Well,
Hi,
thank you
Ray.
for your lecture. I know that you spent this 20, 30 years in the international mission work, and surely you devoted and given your heart, your energy, and your teaching. You help a lot of people. I think your patients and your followers and your students, colleagues are very appreciative. Well, I have been in your house and operating with you for a few days and see you how excellent surgeon you are. And in the outpatient clinic, you extract the teeth and reconstruct it and implant it. I'm an amazing surgeon, really. Well, you are one of my sort of a hero in oral massive surgery as well. So I learned a lot from you as well. Thank you for your constant support to Chang Forum and surely I'm just working webinar. And I hope you can come back again sometime, maybe next year. If you cannot come this year and you come next year, and you're always welcome to Chang Forum. Thank you.
Well, thank you so much. Thank you, Yurei. I definitely will come back. Absolutely come back.
Good, good. So we have some drink as well.
Right. Absolutely.
Yes, perfect. Thank you. Thank you, Dr. Rainer. I'm Pang Yun, and I really appreciate about you sharing a lot of your story for our here, this the junior staff in front of the computer, no matter our friend from the Philippines, from Pakistan, or from any corner in the world. We learn a lot from you this morning. Yeah, for you, this is a very early morning for you. Thank you for your convenient time. Yeah, finally, I would like to invite all of our audience in ICC to have a group photo with Dr. Rainer. Okay, so please turn on your screen and show you a beautiful smile. Yeah, thank you very much. Yeah, should be energetic. Okay, even now it's very late in Asia. Please. All right. Hello, Nisha. Hello, Dr. Lu, Dr. Sato. How everybody? How are you? Okay, so I will count to three. Yeah.
Wait a second. Where's Dr. Lowe? Oh, there he is. I see him.
Yeah,
Okay. Okay, got him.
Okay, so I will count to three, and please give me your beautiful smile. I will take a snap in here. Okay, 1, 2, cheese. Perfect. Another one. I would like to invite you to give me some little heart. Okay. Thank you. So 1,
What's
2,
a little heart?
Yeah, 1, 2, little heart. Very good. Okay. Thank you again, Dr. Rainer. I think you have a lot and more, even more you want to share for us today. probably in the coming future, we can meet in person, no matter in Chang Forum, or we can visit you in Orange County. Okay, thank you very much.
Well, you're always invited to come.
Thank you. And for our next lecture will be spoken and delivered by Professor Fayaz next coming Sunday. And Professor Fayaz will share the typical palate repair and the wire palate repair for all of us. And looking for all of your participation in the coming Sunday as well. Good morning and good evening. Thank you.
Thanks,
Dr.
everyone.
Ratner.
Bye-bye.
Good night.
Bye-bye.
Thank you, Sandy.
Take care.
Bye-bye.
Have a nice week.
You too.
Thank you so much, Professor Ratner.
Oh, you're welcome.
Thank you very much.
And good to see that the
Good.
sun's finally up for you.
Perfect. Have a good day, Dr. Renner.
Okay, thank you. Bye-bye.
Okay, bye-bye.
Bye.
See you. Bye-bye, everyone. Okay, bye-bye, Dr. Venner. Bye-bye.
Bye.
Okay, thank you, Junior.
Okay.
Okay, have a
Bye.
good one.
Tomorrow.
Bye-bye.